slide. So I'm going to look a little bit about medication-assisted treatment that's going on in the U.S. and what's going on in the world. All the slides are on our website, hams.cc/methadone-pptx. You can go right there and download them. So all the countries in blue have some form of medication-assisted treatment, substitution treatment. So there's either methadone or buprenorphine. Most of them have methadone is primary. The ones in red do not. And the main big holdout is Russia. Actually, I was talking to some people from South America yesterday, and they were saying actually in Latin America, the big problems are cocaine and alcohol, and they're not seeing a lot of opioids, and they're not having a lot of push for it. But at least in Brazil, that's what I was hearing. But particularly Russia is a big holdout. Africa is the second holdout. But on some good news, okay. There's 3 countries that have only opioid-assisted detox, but no maintenance. That's Bahrain, Cyprus, and Oman. But in the past decade, quite a number of new programs have opened up, including Afghanistan. This pilot program started in 2009, Cambodia in 2010, Kenya 2014, Kosovo 2012, Morocco 2010, and there's a whole bunch more that I saw but didn't have a chance to write down. So it's moving. There are people, countries are trying it, so it's good. First, let's look a little bit about the problem of opioid use worldwide. Do other countries have a prescription opioid problem like the US? Not exactly. For the oxycodone, hydrocodone, that's mainly in the US, but a lot of other countries have non-medical prescription opioid use, but it's like the older ones. Diverted methadone, diverted fentanyl, there's codeine, Darvon, Demerol, morphine. Those all show up a lot in other countries. Not much of the oxycodone. That's kind of our US thing. Treatment admissions by primary opioid type in the US, about 2/3 were heroin, about 1/3 were other opioids, only 1% for methadone. In the European Union, including Turkey, heroin was about 87%. So when the others were methadone, buprenorphine, fentanyl. A couple countries in Europe do report an opioid other than heroin as the primary problem opioid. Estonia, 86% of admissions were due to fentanyl. In Finland, 86 were due to buprenorphine. Czech Republic had 30% buprenorphine, 7 with methadone, 48% due to heroin, 16 to other opioids. In Australia, the treatment data we got, heroin is about 60% of admissions, and then methadone, morphine, codeine, buprenorphine, other opioids, they're all kind of popular there. But we don't see the oxycodone, hydrocodone things too much. In India, I found some reports about which opioids are injected. So they surveyed 22 different needle exchange programs all across the country. Heroin accounted for, didn't do the percentages, but you can kind of tell heroin was less than half, like about 1/3. Injected buprenorphine, which was usually preparations that were intended to be injected. I don't know if they have those in the US, they have them in India. There were a few people that were injecting pills, but mostly these were intended to be injected. And the Talwin and Darvon were very popular for injection. So other countries do have a lot of prescription opioid problems, not just heroin. If we look at Switzerland and US, lifetime heroin use in Switzerland is at 0.7% prevalence. The US is 1.8% prevalence. Heroin use in Switzerland in the last 12 months is 0.1% prevalence. In the last 12 months for US is 0.4, so 4 times as much. So The heroin problem in Switzerland has gone way down. They used to have the biggest heroin problem in all of Europe. It was huge. So we're going to see that in a little bit. As I said, these slides are all online, so I'm not going to look at the others. Heroin accounts for 95% of Swiss opioid seizures. These are cases prosecuted since 1990, and we see the other opioids, methadone and other opioids, very, very few, mostly heroin in Switzerland still. Same with treatment admissions in Switzerland, mainly heroin, a little bit of diverted methadone, not too much of anything else. Medication-assisted treatment in the USA and Switzerland and Australia will be compared. So the treatment of opioid addiction has been quite a resounding success in Switzerland and also quite successful in Australia. It's quite an abysmal failure in the US, and many reasons for this, but some of them have to do with access to methadone. But first, let's look at how things have changed over time. Because I said it was successful, all right. Number of young people, new young heroin users in Switzerland and the US from 1992 to 2012. US increasing, Swiss dropped from 1.3% down to 0.1%. So great reduction in young heroin users. These are drug misuse related deaths. It's not quite the same as overdose deaths because the Swiss include the F codes from the ICD-10, and overdose would not include that. So it's a little different, but it includes overdose deaths. But we can see the drug misuse related deaths in the USA been going up and up and up. In Switzerland, they've been going down and down and down. So somebody's doing something right. Same with accidental opioid overdose in Australia. Huge reduction from 1999. That was when their overdoses peaked. It was 1999. US increasing. Australia, it's way down, although it came up a little bit recently. What types of overdose deaths are there in the USA and Australia? Australia has about 1/3 due to heroin and 68% or 2/3 due to other opioids, and similar numbers in the US. So it gives us some idea of what drugs are abused. Now we start looking at the medication-assisted treatment now that we've looked at the problem. Switzerland has two types of MAT programs. There's HAT, heroin-assisted treatment, and that is under direct control of the federal government. Uses heroin to treat heroin dependence. It's only available in specialty clinics. And SAT, the substitution-assisted treatment, which is under the control of cantons, the equivalent of states, uses methadone, slow-release morphine, buprenorphine, or levomethadone. And it is available from general practitioners as well as at clinics. Yeah, 2 minutes. So, with Swiss admissions for opioid treatment, most people admitted to psychosocial treatment also get medication-assisted treatment. There were 150 that said that opioids were their main problem. There were 168 that got medication-assisted treatment because someone said it was a secondary problem, got medication-assisted treatment as well. 60% of Swiss substitution treatment is provided by MDs. Clients can pick up their dose at the doctor's office or the drugstore. In Australia, most people dose at the drugstore for methadone and for all substitutes. I mean, it's only the US that says you gotta go to this clinic. Other countries say go to the drugstore, dose at the drugstore. Most people are on methadone in Switzerland. Most people on methadone in Australia. In urine testing in Switzerland, it says, patients should be asked about their parallel consumption of other substances provided there is no threat of sanctions. Their replies are generally reliable. Systematic urine testing does not yield any further benefit, as opposed to the US where it's law. Take-homes in Switzerland, abstinence is not required for take-homes, and they think it helps people to use fewer outside drugs. And the types of payment accepted in the US for methadone maintenance, almost every clinic accepts cash and self-pay. 20% don't accept any insurance, and they are not free. And the insurance coverage is really up and down. There's way too many people that have to pay cash for methadone in the US, and it's a big problem. That's why methadone here is not succeeding. Also lack of availability. Only 27% of clients admitted to treatment for opioid dependence in the US receive medication-assisted treatment. 17 states do not cover methadone under Medicaid. Many private insurances refuse to pay. Many Americans who cannot afford must pay out of pocket. We know methadone reduces death rate 75% compared to active use. Abstinence-based 28-day treatment increases death rates 30 times, 3,000% over active use. So we're doing the exact wrong thing. And it's what's methadone is free. So what we need to do, the US needs to follow the lead of Switzerland and Australia. We need to allow GPs to prescribe and dispense methadone. We need to make pharmacies into dosing points, make all OST free, and stop treating OST patients like criminals and monsters. Thank you.